this series, access calculation. So before jumping into the topic, the one advice which I would give about access calculation is that don't try to have so many methods of access calculation, because there are like so many methods of access calculation, not one, not two, not there. I know 4 to 5 methods of access calculation, but what happens is that when you know more methods of access calculation, you tend to have a confusion between them. You don't have a single method of exact thing that sticks into your mind. When you have know so many, you tend to confuse them. So my suggestion is that if you are confident with one method of access calculation, stick to it. If you are not confident of access calculation, then look at this video, get the one method which I teach you, keep following it, look at the ECG. Every single ECG you see, you try to calculate its axis. When you have calculated some 20 to 30 axis continuously, then you subconsciously, when just seeing the ECG, you will know the axis calculation. The most commonly used method is just looking at lead 1 and lead 3. If both goes away, thinking it as left axis deviation, and if lead 3 comes in, we calculate as right axis deviation. Yeah, that may be well and good if you don't want to go into a little detail, but the actual method of axis calculation, the most used one, I will discuss in this topic. Okay. So first thing, what is this electrical axis? See, our heart has got multiple action potential. Every single cell has an action potential. It originates from a cell and gets diverted in every direction. But the mean direction. So this is the what is it? This is the mean direction of action potential travel through the ventricles during every single depolarization. That is what is called as the electrical axis. We have to know that left ventricle LV has a much bigger volume than the right ventricle. The muscle, sorry, not volume, but muscle mass of the LV is much higher than the right ventricle. So the electrical activity keeps travel from right ventricle goes into the left ventricle. So the mean direction of travel of action potential through the ventricles during every depolarization is called as electrical axis. And this axis, the vector is the direction of the travel indicated by an arrow. This gives the vector. Normally the vector is directed inferiorly towards the left. As I said earlier, this is because of the LV mass. LV predominates. The other chambers, LV predominates, so it goes in this way. So why you should know the axis? What is the point in knowing the axis? One thing is that you can know the position of the heart. As I said earlier, if it's whether a vertical heart or a horizontal heart or the normal position, that you can know. And second thing is that you can know the direction of cardiac activities. Which direction the electrical current passes, that we can know. And the fascicular blocks and the bifascicular block, trifascicular block, LAFB, LPFB, all these diagnosis, axis plays an important role. So before going into the axis topic, I think one thing we should know is that when a wave of depolarization passes towards a lead, if it is, suppose this is lead 2, let us say, suppose this is lead 2, if a wave of depolarization passes towards it, then it will produce a positive deflection in lead 2. If a wave of depolarization is passing away from the lead 2, if the vector is opposite, then it will produce a negative deflection. If it is perpendicular to the electrode, it will produce an equiphasic deflection. It will be one positive and negative. Biphasic deflections will be there. So if it is towards the electrode, it is positive. Away from the electrode, it is negative. And if it is lead, towards the lead is positive. Away from the lead is negative. And if it is perpendicular to the lead, it is equiphasic. So this is, you should know. Then this is the all important diagram that you should know when it comes to axis calculation. So as you have seen in the previous topic, I have seen this is the 3 leads, AVL, AVF and AVR. It goes in this direction, and the limb leads is this lead 1 and lead 2, lead 2, lead 3. These are the 3 limb leads and 3 augmented leads. Now if you put them together into a cardiac imaging, and this is the image that comes. So lead 1, it travels horizontally and it is the 0 degree lead, and lead 2, 3 and AVF, lead 2, lead 3 and lead AVF, all 3 are directed inferiorly. So these 3 are the inferior leads, and lead 1 and lead AVL, which we call as high lateral leads, are in the left side, and the AVR is the negative lead. If the SI node is here, it is going to go in opposite directions. All the cardiac conduction is towards the lead 2. It is a normal position of the heart is towards the lead 2. So lead 2 will have the highest deflection. Whereas the AVR, everything is going to be a negative. The P wave goes away from it, the QRS goes away from it, so it's going to be a complete negative lead, AVR. Okay, so before going into this, we have to know what is the horizontal lead. Horizontal lead is the lead 1. This is the horizontal lead, this is the lead 1, and the vertical lead is the AVF. You see it is vertically negative, lead is negative, and the left lead is the AVL. AVL is the left lead, and the right lead is the lead 3. Lead 3 is the right lead. Right lead is the lead 3. And the intermediate lead is the lead 2. Lead 2 is the intermediate. There is a normal position. The normal cardiac impulse are towards the lead 2. Whereas the AVR is the negative lead or no man's land. So vertical heart, when do you get vertical heart? In emphysema or a COPD, the lungs trying to expand, they push the heart to a vertical position. When it's vertical position, the leads will be lead 3. The vertical lead will, the AVF. AVF will start have a huge positive impulses. And if it is a horizontal heart, lead 1 will have most positive deflections. So horizontal heart will occur in what all abdominal distension, obesity, pregnancy, any abdominal mass. Those can make that horizontal heart. So this is a very important slide, and you have to know two things. Where the leads are, the inferior leads 2, 3 AVF, they are all positive, and the superior leads are negative. AVL and AVF are the two superior leads, 2, 3 AVF are the 3 inferior leads, and 1 is the horizontal lead. And the degree, 1 is 0 degree, and this is 60, 19, 120. 2 is 60, AVF is 90, and 3 is 120. And the two upper leads, AVL is minus 30 and AVR is minus 150. This image you should keep in your mind, and this is very, very important. Take time, get this oriented, read it multiple times, have this image in your mind. So this will make access calculation completely easy. Okay, so first thing, we'll say what from first step. I think how I read this is this way. Step 1, look at the normal lead 1, lead 2 and AVF. Why I am saying to look at these 3 lead is that normally the electrical impulse of the heart is going to go in this direction. So this direction. So either lead 2, 1, 2 and AVF. 1, 2 and AVF should have the highest QRS duration. If lead 1 or lead 2 or AVF has the tallest QRS complex, if any one of the 3 has the tallest QRS complex, and if AVR is completely negative, this is the normal axis. So this is the first thing you have to see in any ECG. Any ECG, look at 1, 2 AVF. If 1, 2 AVF, any of the 3 has the tallest QRS complex, then look at AVR. If AVR is completely negative, then this is the normal axis deviation. The step 2 is that if 1, 2 AVF does not have the tallest QRS complex, then you have to look at lead 3 and AVL. So lead 3, as I said, is the right lead. Lead 3 is the right lead and AVL is the left lead. This is very important. If we'll see know why. If then you look at lead 3 and lead AVL. The step 3. If lead 3 has positive or tallest wave, the tallest QRS, positive and tallest QRS, and AVL has negative QRS, then you have to think in terms of right axis deviation. Yeah, this is because you see if the wave of depolarization is going towards lead 3, then it should be a right axis deviation. Okay, so then the lead 3 will have the tallest QRS complex and AVL will have negative QRS. Then step 4 is the opposite. If lead AVL has the tallest QRS and lead 3 is negative, then you have to think in terms of left axis deviation. Why? If the lead is traveling towards this side, the AVL is on the direction. So AVL will be positive and the lead 3 will be in the opposite direction. So lead 3 will be negative. And this is left axis deviation. And this in this area, this is the right axis deviation, and this area is the left axis deviation. I will come at separately. And step 5 is that if none of them are positive, none of them has a tallest QRS complex, and if AVR has the tallest QRS complex and all other thing are negative or equiphasic, then you have to think in terms of extreme axis deviation. So this is how you have to see. First step, look at lead 1 to AVF. They are the normal directed leads. If 1 to AF has the tallest QRS complex, then it is a normal axis deviation. Confirm it with a negative AVR. Then if step 2 is that if either 1 to AVF does not have the tallest QRS complex, then look at lead 3 and AVL. Lead 3 and AVL, if lead 3 has the tallest QRS complex and AVL is negative, then it is right axis deviation. If AVL has the tallest QRS complex, lead 3 is negative, think of left axis deviation. AVR has the tallest QRS complex, think of extreme axis deviation or indeterminate axis. That way you have to think. Then other thing you have to do is that you have to know the degrees. So what is the lead 1? As I said earlier, if lead 1 has the highest positive QRS complex, then it is 0 degree. Or if lead 2 has the highest complex, then it is based on the previous diagram which I showed you, it has got 60 degree. That is the this thing. Lead 2, if positive, you have to put it as 60 degree. Lead 3, if positive, you have to think in terms of 120 degree. Or AVF. If AVF has high tallest QRS complex, think of 90 degree. And if AVL has positive QRS complex, think of minus 30 degree. If AVR has a highest positive QRS, think of minus 150 degree. Okay. Now, conditions having left axis deviation. Left axis deviation can have, there are numerous conditions. LAFB is one of the very common cause, or any condition that causes left ventricular hypertrophy in case of aortic stenosis or hypertension or HOCM. All these conditions can have prominent left axis deviation. Right axis deviation, think in terms of right ventricular hypertrophy. Anything that causes right ventricular hypertrophy, it has pulmonary stenosis, pulmonary hypertension, pulmonary embolism, or in case of left posterior vesicular block, all these things can have right axis deviations. And normal axis deviation is between the other 2 degrees. So, and as I said earlier, vertical and horizontal heart, they can be seen in certain conditions. Now, this is just theory. What we have learned is that theory of the frontal plane axis. Now we will start seeing ECGs and start applying it. So pause the video and assess the degree, and then you start watching the video. Now, when I start the degree video, first thing is that I look at lead 1, 2 and AVF. And I am sure that lead 2 has the tallest QRS complex of all the leads. So I'm looking at the AVR. So AVR has got both the P wave is negative and QRS is negative. So in my step 1, I can say that this has got normal axis deviation. Why normal axis deviation? Lead 2 has the tallest QRS complex and AVR is completely negative. Okay, so this can see. And what is the degree? As I said earlier, the lead 1 has got 0 degree and AVR has got minus 150 degree and AVL has got minus 30 degree and AVF has got plus 90 degree and lead 2 has got 60 degree and 120 degree. So here the tallest QRS complex is this 60 degree, so the axis should be around 60 degree. So this is a little higher level of axis determinations. So normal axis around 60 degree it is there. So it is the normal position. Then second, you look at this ECG. Again, pause the video and try to answer this. Okay. Now I say first step 1, look at lead 1, lead 2 and AVF. I am pretty sure that 1, 2 and AVF does not has the highest QRS complex. It is the lead 3. Lead 3 has the highest QRS complex. So my step 1 is negative. So step 2, I am looking at lead 3 and AVL. I'm my step 3, I'm coming that lead 3 has got tallest QRS complex and AVL has got a negative QRS complex. So this is an example of right axis deviation. Now coming to the degree. Now lead 1 AVR has got minus 150 degree and AVF has got plus 90 degree and AVL has got minus 30 degree. Lead this has got 0 degree, this is 60 degree and 120 degree. So lead 3 is 120 degree. My axis is right axis deviation and this is more than around 120 degree. This is the axis determination. Now going down, looking at the next ECG example. Just again pause the video, try to answer. If not, I will try to explain. I'm just looking into the axis. Don't look into other things. Let's not confuse the dictum. We'll go step by step. Okay. So first step, lead 1, 2 and AVF. And I'm pretty sure that lead 1 has got 11 small, up to 11 is there. But again, AVL is much more taller than lead 1. So my step 1 is gone. Step 1, not 1, 2 AVF did not have the tallest QRS complex. Then the step 2. Now I am looking at lead 3 and AVL. In my step 3, lead 3 is not positive, and we are going to the step 4. Step 4, AVL is the tallest QRS complex and lead 3 is the has got a negative QRS complex. So this is an example of left axis deviation. So both 1 and AVL are positive and 2, 3 AVF is negative. This is an example of left axis deviation. Now the degree. We know AVL has a degree of minus 30 degrees. So it has a taller. So it is around minus 30 degree. Between 1 and minus 30 degree. The 0 and minus 30 degree. That is the direction of axis determination. So I hope I've given you some reasonable idea about axis determination. So if you try again, that's what you have to start seeing ECGs and try to localize it very frequently. The most common method to use is that this method. You look at lead 1 and lead 3. So lead 1, if you say if you just lead 1 and lead 3, both are going together. Lead 1 and lead 3 are facing each other. So this is, they say, right axis deviation. And again, lead 1 and lead 3, if it is going in opposite direction, that is example of left axis deviation. That is one of the shortcut method. The shortcutest method of axis determination. But this way you can try to be low. That can fail you in some times, and this won't fail you at any time. Thank you.